So if you are someone that is used to look at the color coding, then you might miss cases like that if you don't look at the increment of the elevation and corneal thickness. So we can also look at the Pentacam and find a history of refractive surgery. Usually patients forget about their glasses prescription, and as we all know that nowadays every cataract surgery is a refractive surgery. So how you will know that this patient had myopic ablation? We look at the relative pachymetry and tangential curvature. As you know, when doing myopic ablation, you flatten the center of the cornea. So if you look at the relative pachymetry, it's a minus. So that means that the center of the cornea is relatively thinner than the periphery. And also on the tangential curvature, the center of the cornea is, you'll find flat case, while the periphery of the cornea are steep. Also, by looking at the K1 and K2, you will find flat case. Looking at on the cataract pre-op, if you look at the myopic axial sagittal back front ratio, in myopic ablation, this ratio will be less than 80. While hyperopic ablation, when you do the ablation, the periphery will be, you will flatten the periphery and the center will be steep. So looking at the relative pachymetry, the center is relatively thicker than the periphery. And also on tangential curvature, you will find steep numbers as in this one, 48, 46, compared to the periphery of 38, 35. And again, on K1, K2, steep case. And while looking at the axial sagittal back front ratio, this number will be something more than 83. So why it's important? Because if you don't recognize it, you might end up off target on your IOL choice. Angle kappa is also important, especially in hyperopic eyes when you do laser refractive surgery. You can find the pupil centration. This circular dotted line is a pupil, and this cross is the center of the pupil. And if you look at the chord mu, here corresponds to the angle kappa. It's recommended that your angle kappa is less than 0.5. This is especially important for laser refractive surgery, because if you don't set up the ablation on the vertex, the patient will end up looking through the transitional zone rather than the center of your ablation. And here also you can find how much is displaced the center, the pupil center. How Pentacam is important in premium IOLs, angle alpha. We also looked for decentered ablation, early keratoconus, and higher order aberrations. On here again, on cataract pre-op scan, you can find the chord alpha, which corresponds to the angle alpha. Dr. Ammar already went through these numbers, so I'm not gonna go through them again. While here also you can find the total higher order aberrations at 4 millimeter. Also, as Dr. Ammar said, it's recommended to be less than 0.3. And look at this patient. This patient with keratoconus has very higher order aberrations at 4 millimeter. Also, you can look at if there is a decentered ablation, as in this patient. And thank you very much.